for Life on WHCR Radio. That's Harlem Community Radio, 90.3 on the FM dial. Today I'm thankful to be the consulting host on Black Medical Doctor Forum, thanks to the executive producer, Bryan Russell Garfield. Today's guest is Dr. John Pope Mitchell, ophthalmologist based in Harlem.
In the holding area. But I would run out of time. I couldn't always get there. So I try to pray here before we leave. I have a special prayer. I'll tell you.
So where did you pick up?
Long story short, Bethel Gospel Assembly, Bishop Ezra Williams. And he was I was not a member of Bethel at the time. And I said, you know what? I would pray at home the night before. I said, well, let me say a special prayer for the bishop while I'm here. He appreciated it. And the surgery went fantastic. The turnout, very good. And I said, you know, maybe I need to verbalize it with the patient as opposed to just keeping it internal.
This is great.
And so from that point on, I started to pray with my patients. You know, I asked them first, are you Christian? And they said yes. And we pray. Almost the only people who have ever turned me down are Jehovah's Witnesses. And that's been few and far between. I've had people who are Spanish who want me to pray with them. In fact, we were at the OR at St. Vincent's. I won't hold you up. But essentially, I didn't know what it was. Yo quiero bendición, bendición. And fortunately, I speak fluent Spanish, but I'm not familiar with the words that they use of prayer. Anyway, that was the word for prayer. And so my resident was with me from Colombia. He said, Chile. He said, he wants you to pray. So we stopped right there before the operation. And we prayed. So they know, apparently knows that I pray or whatever, but then it was good.
Excellent. Anyway. Dr. John Pope Mitchell, we're very happy to have you on our program today. It's an honor to be with someone that I met way back in 1973 when you were at Harlem Hospital, along with Dr. Edward Neal and others. Tell us how you began to pursue medicine. What got you interested in that?
First of all, it's an honor for me to be here, and I appreciate your having the opportunity to interview me, and my thanks. You know, I was 5 years old, and I lived at Bedford-Stuyvesant, Brooklyn, in a brownstone, and we had a doctor named Dr. Critchlow, and he would come to visit us. This is when doctors made home calls, house calls. And there was something about him. He had this tie, he had this black bag. There was something, aura about him. And at 5 years old, I said, you know what? I think I want to become a doctor. And from that point on, I had it in my mind that I was going to pursue medicine. And I never lost sight of that. I always wanted to be a writer and write short stories and plays. But at the same time, I said, you know, this is what I want to do. And I was blessed because I wasn't floundering around trying to find, what do I want to do with my life? I knew at a very early age. And it was reinforced, especially as I went in undergraduate school and I had the opportunity to go to a good school. But I always thought that it was important to give back to the community.
Now, as you grow from the 5 years of age, as you progress along, this particular thought of being a doctor is nurtured by any number of things. You go to Cornell, and that's where you do your bachelor's work at, and then you move into Cornell's School of Medicine. At what point did you see the nurturing the health of the eye as your focus?
I want to, before I go, just say there's one individual, I have to give credit to two individuals, Dr. Dorothy Trice, a black woman, and Dr. Herbie Cave, anesthesiologist from Harlem Hospital. These were my role models growing up. So I grew up and was nurtured. They in particular nurtured me. I can remember Dr. Trice coming to our Thanksgiving dinner year after year, and I would always be asking questions, and she was so patient, so patient. She lives in California. She does travel back to New York. Herbie Cave, as many people may know, wonderful activist, physician, beloved by everyone, and just such a humble person. If you ever met him, I'm Herbie. You'd never know he was a doctor. until it became apparent that it would come out in conversation. But anyway, those are my two role models. The eye struck my attention again through two black doctors. One was Dr. Herbert Jordan. He practiced ophthalmology and was an attending at Harlem Hospital. And Dr. Patricia Bath. At the time I met Patricia, she was a resident in ophthalmology at NYU. And I liked using my hands. But I didn't like a lot of blood. I was not in the mindset of a surgeon who likes to stay in the operating room for very long periods of time. And I also like neurology and behavior in particular. In fact, at one point I thought I'd be a psychiatrist. Thank goodness I found ophthalmology. But they said, you can meld neurology and ophthalmology. There's a subspecialty called neuro-ophthalmology. So when I finished ophthalmology at Harlem Hospital, then I pursued neuro-ophthalmology at the Presbyterian Medical Center, the Eye Institute, and the Neurological Institute.
Give us those two pieces: ophthalmology, neuro-ophthalmology.
Yeah, ophthalmology was a 3-year program where you learned about the eye and all the diseases associated with the eye, from the front to the back. The neuro-ophthalmology, which is a subspecialty, particularly deals with neurological diseases that affect the eye, such as multiple sclerosis, MS, strokes, thyroid disease, patients who have a nerve palsies that affect the movement of the eyes. Diabetics in particular may have nerve palsies that can affect the eye, and other diseases as well. So neuro is a part of ophthalmology, but in particular dealing with neurological diseases as they affect the eye.
When you look at the groupings of patients that you've treated over the years, you're based in Harlem here on 135th Street, and I would imagine that the majority of your patients are reflective of the community, meaning black. When you look at the various areas where you've operated, and I'm saying from the standpoint of being an ophthalmologist, whether it's in Harlem or elsewhere, what differences do you see in the diseases that occur among the different groups whom you've treated?
Yeah. In the African American community, our biggest problem is glaucoma. We have by age 11 to 12% of our people will be affected by it, as opposed to the Caucasian population, which is between 2 and 3%. Glaucoma, silent thief of terms of vision, and it's very, very common among our people, so that I'm looking for that disease. That would distinguish us from the Latino population as well as the Caucasian population. The other thing we find is, as we tend to suffer from diabetes to a very large degree, and hypertension. We see a lot of complications from the diabetes, particularly when you get beyond the 10 to 12 year window, when if you don't get the diabetes under control, then you're going to suffer on the back end. And that means going forward after 12 years, people will ultimately begin to have hemorrhaging, they'll have serum leaking from the blood vessels. And so I see that commonly. And I guess that is linked to our diet, our habits, and how we take care of ourselves, how we approach disease. I mean, do we look upon our treatment of diabetes, hypertension, high cholesterol, and no, we've got to alter it in the early stages of our life. But it goes back to America in general, not just black folks, but everybody in America, where we are losing that battle against obesity, and we're losing the battle against a lack of exercise. And so if we can, so those are two particular areas. And then, generally speaking, we're pretty similar. The cataracts, for example, I treat a lot of cataract patients, and they have surgery, which I perform at several different institutions. But that's prevalent in our community, but probably to the same degree that is prevalent in other. We also, of course, we tend to have a lot of refractive errors, so patients need glasses, especially over the age of 44, 45. Interestingly enough, as a contrast with my Latino population, I find among Hispanics they have an earlier age at which they need glasses, between 36 and 40. And just parenthetically, I am going to have a study published in the Journal of the National Medical Association where I did research in Venezuela. We saw about 1,200 patients. Part of the thing I like to do is medical missionary work in ophthalmology, but that's a story we could save for a later time.